what they found is people with chronic or reoccurring low back pain, that is not the case. There is a delayed response in the firing of the intrinsic core. Now, what came first, the chicken or the egg? They don't know for sure. Does somebody have a faulty nervous system firing pattern, and that's why they ended up with their back problems? Or did the back problems cause this delayed firing response because, you know, the pain, and it slowed down this reflexive response? That is debatable, and there are people that argue it one way or the other. But what I do and what you do, we don't care. We just know that it improves if we work with the nervous system firing. So balance, coordination, agility exercises, and some core stabilizing exercises.
Hey, what's up, everybody? And welcome to Catalyst for Change podcast, where you get to hear from your professional health and fitness team. My name is Jim Adams. I'm the owner of Catalyst Personal Training in University City, and I'm here with another member of your team, Dr. Jeffery O'Guin, who owns O'Guin Wellness Chiropractic and Rehabilitation in Kirkwood, and Embody Personal Training, which is also in Kirkwood. He's got kind of a unique model in that he's got a hybrid where he's got a personal training clinic attached to his chiropractic practice as well. So, Doc, welcome to the show. Welcome back to the show, I should say.
Fun. Back second time, number 2.
Yeah, number 2 of many. Yeah, because you're going to be a regular contributor on the show. So happy to have you. Well, let's go ahead and launch right into it. See, you wanted to talk about when core exercises are not good. What does that mean?
So we see a lot of people that are trying to be proactive. So they come in on our chiropractic side, and I think I'm doing everything I'm supposed to be doing. I'm doing my core stability. But then they're like, but I keep injuring it, but I keep doing it because I think, for all the YouTube videos I watch, I'm supposed to exercise my core. So I'm doing the planks, and I'm doing Russian twists, and I'm doing all of this stuff, but gosh darn it, it keeps hurting my back. So I figured I'd finally come in and see a chiropractor because I'm getting frustrated. And there are a couple of situations in which certain core exercises are contraindicated. It's not what they need at that moment. And the two really big things are in certain acute disc injuries, especially some type of a disc bulge, just the process of bearing down, of straining, which is, of course, I mean, you've heard of the Valsalva maneuver when somebody bears down,
holds their breath and kind of braces. Yeah.
So that's an actual orthopedic test, one of many orthopedic tests, but it's one potential orthopedic test to say, hey, we think you've got something pressing up on your nerve there, because when you bear down like that, if it causes pain, usually that means it's spinal related. And there can be other causes of this, but one of the most common is you've got a disc bulge pressing against a nerve. So if bearing down bothers them, well, any kind of core stability exercise is a major bearing down of that. And so there are cases that, you are re-aggravating that every time you do that core exercise that you saw on YouTube. Could even be my YouTube videos, my silly videos, but there are cases that, so that's one example. Now there is something else, and we can double back and talk more in depth about either of these if you want to, but certain core exercises, even a front plank. So they found that holding a front plank, yes, there's a lot of abdominal activation, but there's almost just as much hip flexor activation. For those who don't know, one of the main hip flexor muscles is your psoas muscle. It attaches to the front of your spine. So for some people, especially if they're not holding a plank properly, if they kind of fall into that pelvic tilt, that anterior pelvic tilt, well, now they're causing a shear because that muscle that's attaches to the front of their spine, it's heavily engaged, heavily activated, and it's shearing on that lumbar spine, which really just means it's causing extra forces through that lumbar spine. And then for some people that can aggravate it.
Yeah. And that's a great point, because when you sit in an office chair, you sit in a chair, your hip flexors are in a shortened position, right? Yes. And if you're a runner, then usually they typically have tighter hip flexors as well, right?
Yeah, they can. Yeah, they're not proactive with it. They can. Right.
If they're not proactive with their stretching and range of motion exercises. So if you are already predisposed to having tight hip flexors, and then you get a disc bulge, and then you go and do that front plank.
Oh
and
yeah, double whammy.
Exactly. You're asking for trouble. Absolutely. So that's one situation where, like, when you kind of bear down, or what I call brace, then usually, but those disc bulges, I can usually tell it because it's a sharp pain. It's one of those like where you're like, oh, like that, right? Or is it more of a dull?
It can be either. I used to teach at Logan before the whole COVID thing. And I would always say disc injuries are elusive because, and that's not me saying that, that's me piggybacking off of what most of the texts say and kind of finding my creative way to explain it. But they're elusive because sometimes it can be sharp. Sometimes it can be more of a dullness. Sometimes it just causes a stiff, the surrounding muscles will get really stiff and tight around it. So sometimes it's masked by this muscle tension. Like, I just feel like I have a tight muscle. But then we do a nerve tension test. It's like, yeah, you got more than a tight muscle. You've got a nerve tension problem going on in through here. So they're elusive, and it could go either way. It could be the sharp that you described, or it might not necessarily be.
Okay, good to know. All right, now you said there were two situations.
Where the Valsalva maneuver, the bearing down, or if they, like you said, the tight hip flexor problem, because the hip flexor activation causes the shearing. So those would be the two, the shearing.
Okay.
And let me explain that a little bit more. And I'm going to try to describe it in words the best that I can, because I know most people probably aren't watching. But you've got the bones of the spine that are stacked on top of each other, and you've got the disc that's in between them. And I always say this, the disc, to simplify it, it's kind of like a spacer in between the bones of the spine, the vertebra. And they can kind of move back and forth across each other a little bit, like a shearing movement in through there, if they're unstable. And that's what an unstable spine really means. The tendons, the ligaments, the capsules that are supposed to be nice and taut and protected, well, that's not the case for some people. And so things will just more easily shift. And now if you take a spine that can shift really easily, it's unstable, and then you take a hip flexor activation in a certain position, then it's just going to kind of pull and create that force through there. And so they do absolutely want it. Now, in those cases, they want to learn the brace, but you might be better off focusing on something like a dead bug. Most of the people listening to this probably know that, but if not, that's where you lay on your back, press your low back into the floor. They used to call it the dying cockroach when I was in like high school football practices and stuff. But yeah, that one, there's maybe a better place to start, because your hip flexors are in a flexed position. So you're not putting that hip flexor stress through the spine, but you're still engaging the abdominal muscles.
Yeah. And I appreciate you explaining those two situations, because I would guess that they're fairly common in the general population, especially since COVID. Yeah.
Yes. And that's what really can make it frustrating, because we get a dozen, patients per week sometimes that have one of those two scenarios. And yeah, if they're trying to do core exercises on their own, sometimes they are going to lead to a frustration.
So in those situations, obviously the answer to every question is it depends.
Yeah, of course. Yeah.
Right.
And
yeah.
I can go through what's the best way for each of them, if that's what
that's what I'm trying to get to is like, so in that situation, so obviously core stability, planking, bracing is not the answer for that problem. So what would you recommend?
So let's start with the easier one, which is the second one we talked about. The hip flexor activation bothers in the shearing. They absolutely do need core stability. And actually, let's define the core for a minute, because I think some people just think the core is the pretty ripped up, the muscle that you can get ripped up in the front. And I always say, in a lot of the textbooks and the people who really study core stability, people like your Stu McGills and a whole bunch more of them, they usually don't even consider the rectus abdominis, that pretty stomach muscle in the front. That's a lot of times not even considered part of the intrinsic core muscles.
Right.
The muscles that are considered are the ones more on the side, the transverse abdominis muscles, the pelvic floor muscles, the diaphragm that sits on top, and then a group of really thick muscles, the deepest layer of muscles in the back of the spine called the multifidus muscles. Those four are usually considered and agreed upon by most as the deepest layer of protection that we have. The reason that they say that those four are the deepest level of protection and considered the intrinsic core is because they've done enough studies now. They'll take somebody and have them all hooked up to EMGs and see what muscles fire with what activities. And maybe they throw a ball at somebody and somebody reaches up to grab that ball. And they'll say, what's the first muscle that fires in that? It's got to be a shoulder muscle, right? Because they reach their shoulder up to grab the ball. It's incorrect. The first muscle that fires is the transverse abdominis, which is a side stomach muscle. And so they say, wow, okay, that makes sense because we've got to stabilize our platform. The core really is talking about the pelvis, and the pelvis is our platform. It kind of joins our spine with our hips. It's that intermediary between our spine and our hips. So that makes sense. We've got to stabilize that before we start moving our hips. And the same thing is true of our hips. Before we take a step, these same muscles will fire first. Now, right behind that are muscles like those other ones that I talked about, the multifidus, the diaphragm actually engages and the pelvic floor engages. So those muscles seem to have the most protective response at the deepest level. So if we're going to talk about core stability, I think we should define that first. Now, you could even go a step further and say, actually, any muscle that attaches to that pelvis could be a core muscle. And that would include those hip flexors and that psoas muscle. So there's our kind of a good definition of saying, okay, what are we talking about when we mention the core?
When you say intrinsic, what do you mean by that?
So really what I'm just saying is maybe the deepest level that really has a protective response or a stabilizing response on not only our spine, but our pelvis. So at the deepest level, and important.
Gotcha. It almost acts instinctively without thinking.
Yeah, that's it. That's spot on because your nervous system does it. And that's a good point because you're like, well, I don't try to brace and bear down before I lift my arms. You don't have to. Your nervous system does it. And actually, I'm glad you brought that up because what they found is people with chronic or reoccurring low back pain, that is not the case. There is a delayed response in the firing of the intrinsic core. Now, what came first, the chicken or the egg? They don't know for sure. Does somebody have a faulty nervous system firing pattern and that's why they ended up with their back problems? Or did the back problems cause this delayed firing response because, the pain and it slowed down this reflexive response? That is debatable. And there are people that argue it one way or the other. But what I do and what you do, we don't care. We just know that it improves if we work with the nervous system firing. So balance, coordination, agility exercises, and some core stabilizing exercises.
Yeah, and that's a good point when you talked about the nervous system and kind of that instinctual, kind of almost primitive firing of those muscles before we're even conscious of it. And a lot of times it never even enters that consciousness, but what's the word I'm looking for? Emphasizes the importance of the nervous system in core training. Because a lot of times when my clients come into our club, they think core, they want crunches, they want ball throws, they want all of this stuff. But then when I do like simple things like contralateral curl to overhead press, then they're like, why is this core? And it's everything that we just talked about, correct?
No, yeah, you're spot on, brother. And we do a lot of like single leg stuff, even something like a single leg RDL, or even simpler than that, like the hip airplanes, anything single leg. If you're in yoga, you could call it a warrior 3. I always joke around like half of a yoga class is standing on one leg. And, it seems silly, but there's great value to standing on one leg.
Absolutely. Yeah. Yeah. I recently started taking Pilates, and let me tell you, my left leg was slacking. So I was glad I got in there so I could bring it up to speed. All right. So then you have to, pay attention to the nervous system and everything. And so now we're understanding that there's levels to the core. So, now let's bring it back full circle and get back to those two scenarios.
I love it.
So what do we do to help people in those situations?
So well, like I said, we'll start with the second one because it's easier. And let's say that's if they've got that shear instability and the hip flexor activation, say a front plank, or in quite honestly, even a crunch or a sit up, if those things bother it, we still want to work the core. We absolutely want to work the core, but we want to do it in a more creative way. That could be, I already mentioned the dead bug exercise and describe that. That could be something like your anti-rotation or your pal-off press. I like those a lot. For listeners that are maybe unaware, I'll describe it briefly. You essentially take a resistance band tied to something to the side of you, but kind of at the same height as your chest would be. You grab that resistance band, you step away a little bit, and then you press it out and hold it out in front of you. And the band's trying to pull you into rotation. So they call it anti-rotation because you're staying steady and staying firm. This is maybe a good time to mention core stability is not the ability to move through your spine. It's the ability to resist movement. Another one that I like, and I'm sure we run in the same circles, all the Perform Better people and the Mike Boyle, like all of that functional training people.
Ray Cook, all those guys,
all those guys. And so the one that they like for the anti-side bending would be either a side plank, could be great because there's no hip flexor activation or minimal hip flexor activation, or something like a suitcase carry where you're going to hold a weight, a kettlebell, a dumbbell in one hand, and don't be that person in the gym that's kind of taking it down to the side and back up, you know, holding the weight in one hand and doing the side bending. All you have to do is hold a heavy weight in one hand. It's trying to pull you to the side. So as long as you just stay upright and walk a straight line, you're using your core. Oh, and by the way, you're getting some of that nervous system because as you stay upright and you walk a straight line, it's trying to pull you in this direction where the weight is. So if you walk a straight line, you're getting crazy nervous system benefits out of that as well.
Yeah.
So there's a couple examples, and there are many more. And actually, let's talk about this too. And this becomes more challenging to do in words. Visuals help a lot, but I'll do the best that I can to describe it. Those multifidus muscles that I talked about, commonly neglected.
Now you want to explain what the multifidus, because they're tiny little muscles that are in between each vertebrae, correct?
Yep. And they go all the way up, but they're the thickest and most dense in the lumbar spine, in the low back. But they go all the way up close into the neck. I mean, you have multifidus muscles into your cervical spine and your neck. So they go from the low back all the way up into the neck. They're just the most thick and the most dense and the most protective in the low back. Now, those are interesting muscles. They're not really muscles that move us very much. They really seem to have more of that stabilizing role that we described, meaning they do more of a role of resisting movement. They do help us resist rotation. So that pal-off press I talked about will help engage those. They also help us resist extension. So whereas the hip flexor activation pulls the lumbar spine into a little bit of extension, and for people listening, extension really just means kind of think about a backwards bend through your low back. And those hip flexor muscles they flex the hip, but if the pelvis is stable and they're activated, they really extend our lumbar spine by bringing our pelvis forward into a tilt. The multifidus muscles kind of have an opposite, they counteract that force. So if we can engage those multifidus muscles, now they've got this counteracting force to the hip flexors. So if we can take an exercise, something like a bird dog, and if you can kind of resist that temptation to go into that into that anterior pelvic tilt, if you can resist the temptation, which is why so many exercises like a dead bug, they say flatten your low back. So if you can kind of flatten that low back and engage, and it could be with a glute bridge, it could be with a bird dog, it could be with a deadlift. I like deadlifts. I love kettlebell swings in the right circumstance.
Right.
But those are all ways that you're going to want to develop the multifidus muscles. And there's more, but you really want to go ahead and get a little bit of an engagement of those muscles, because the research shows that people with chronic and recurring low back pain also, in addition to the delayed firing of that transverse abdominis, the multifidus muscles they have less circumferential area. They essentially start to atrophy. We want to do everything in our power to get those muscles strong again. So we got to engage them. And sometimes that means load them with more resistance, like something like a deadlift or a kettlebell swing.
Gotcha. Where they
single leg RDL is a great one as well. I love the single leg RDL for that, because you're kind of getting that same movement as a deadlift. but holding the kettlebell in one hand or dumbbell, whatever you decide to use, it's trying to rotate you. So stabilizing and kind of countering the balance to resist the rotation, you're going to get a great activation of those muscles.
Yeah. And I love that you talked about anti-rotation, because pre-COVID, we used to train a lot of hockey players, and now we train some golfers. And golfers, you know, all they want to do is they want to drive the crap out of that ball, right? They just want to come around. And so a lot of them fall under the notion that, you know, a bigger range of motion, a bigger swing will help them. But I have to convince them that all the power from their swings comes from the anti-rotation and the stabilization of that spine. Can you explain that a little bit further to the listeners?
Yeah, so I like it. So I kind of who's that? Is that Greg Rose, the TPI guy, Titleist Performance Institute? Yeah, so they do so many things that kind of like you said, you actually want more of that mobility through the hips. So they've got a lot of drills to increase the, what's the Happy Gilmore? It's all in the hips, baby. All in the hips. Come on. So you want to be able to rotate through the hips. So they do a lot of hip rotation drills to get that. And yeah, you want to be able to have that core stability in through there. And there's so many, and we're talking about nervous system, you know, for the golf swing, there's so much nervous system involvement, because really you want relaxation, like kind of like a whip.
Right.
But then you went at that moment of impact, you want that stability, like you said. So
yeah, you want to lock it in.
Is great to teach that.
Yeah.
And then there'd be phases. And then once they get that down and you've got that foundation, then maybe you could do the rotational med ball throws against a wall or something like that, that could help kind of put it all together, help give you that, drive that power through there, drive the power through the hips and keep the core engaged and stuff like that in through there. So that's spot on.
Yeah. So I want to make sure that we cover this. I feel like we covered it for the bracing, but what about for the hip flexors? Like, what if they're like, what are some of the remedies to get to deactivate the hip flexors, get them to calm down, stretch them out, whatever, you know, improve tissue quality?
Yeah, absolutely. So I like to do a kind of a combination of things to stretch the hip flexors. We don't really have to overcomplicate it. The traditional, like they call it the couch stretch or the chair stretch and those different things, which for listeners, I'll just describe it really quickly. And you could get into a kneeling position where one knee's on the floor and then the other foot is out in front of you. So you kind of like in a split stance position, but on your knees, or whatever knee you're stretching or whatever side you're stretching, that knee would be down. You want to avoid, so here's where it becomes very interesting, because a lot of people will do this stretch and what they do is they arch backwards through their back because they try to drive that range through the low back. So you've got to teach them the brace that you described. I teach them the posterior pelvic tilt, keep them out of the anterior pelvic tilt, and then drive the hip forward. And then if we want to make it a little bit more aggressive, we could that knee that's down, we could put something to put that foot up closer to the butt.
Yep.
That alone is a great way to get the hip flexor. Now, I also like to do some hip flexor activation. So like you said, you know, people sit all day, the hip flexors are tight. But something I talk about over and over again is the default mode for a muscle that has poor coordination is tightness. And so with the hip flexor, we want to actually activate it a little bit because, it's shortened, but shortened doesn't mean that it's strong. Shortened just means it lacks the ability to have length and allow us to generate mobility through it. So I like to activate the hip flexors. And there's, again, things that I could demonstrate. It's a little bit harder to describe, but there's a lot of different things. But you could use a TRX strap, get in like a split squat position, and then press your leg down into the TRX strap, the leg that's behind you, and kind of drive that down to the floor as you do maybe like a split squat. That way your hip flexor is activated. But then as you go down, really try to drive hip extension while it's staying activated. So you get like this nice eccentric activation of the hip flexors. Anything you can do to get that eccentric activation sometimes is going to help improve the coordination of it, and it will more naturally loosen up.
Yeah, I like that on the TRX. It's like a Bulgarian squat on a TRX, or what I call a Pilates squat on a reformer.
Yeah, Pilates squat. That's good.
The same thing, the same concept. Yeah.
Yep.
Okay.
Yeah, and there are other ways. That's just the one that came to my mind. I feel like I could describe somewhat,
Yeah.
you know, for listeners that have somewhat of an understanding of certain movements and exercises, that's something that they could understand. So yeah, that address, you know, that's at least kind of in a nutshell, some things to consider and think about for the hip flexor. Do you want to talk about the disc bulge as well? And okay, what do we do for that? So in those cases, you know, it might need to heal before we do core stability exercises. This could potentially be a case where we say, you know what, we're going to hold off on core stability exercises, maybe for a week, maybe for a month. We don't know. We monitor and see how they respond. Some treatments for disc bulges could be some form of a traction or a decompressive therapy. Some people respond really well to that. There's something called end range loading, which essentially is kind of like a cobra. I don't want to say a cobra pose because you're not holding it, a sphinx kind of a position. I'm usually pretty versed in my yoga poses, but I can't think of anything else they call it. But essentially you're laying on your stomach, you're on your forearms, and you just rest and you let your back bend backwards. That one is a double-edged sword. For some people, it's going to be the greatest thing in the world because it kind of drives the forces. It counteracts all the flexion forces they've had all day long. And so for some people, that's a fantastic stretch to get into, and it helps a lot. We have to remind ourselves it also closes up the space that the nerve goes through. It makes the space smaller. So if they've got a really swollen nerve at that time, it could potentially make problems worse. So you gotta kind of have to listen to your body, or this is a case really you kind of want to be working with a professional, some kind of a spine health professional, whether it be a chiropractor or physical therapist, but somebody that kind of is versed in some manual therapies to help guide you through some of these in through there. Disc bulges also, in addition to the mechanical manual things that we can do, and maybe some adjustments, some traditional chiropractic adjustments help get some fluid, some flow through there, and it helps calm down inflammation. And then some other things beyond that could be nutrition, anti-inflammatory diets, taking anti-inflammatories, making sure you get good sleep. If you're not sleeping well, there's an inflammatory response, a stress response that leads to an inflammatory response. So there's a whole host of things that could go on with the healing. That could be an entire podcast in and of itself.
Yeah, I agree. And sometimes when I get a disc bulge, you know, just good old fashioned ice helps me.
Yeah.
Yeah. Just, you know, laying down and on some ice does wonders, you know. So where I can get up and start moving a little bit, get a little bit of mobility out of it till I can kind of wiggle its way back in there. Yeah.
Yep. And that's what you want to do. And it's like a lot of injuries. You want to move it the right amount, not too much, not too little. Too sedentary, more inflammation, more swelling takes hold. Moving it too much or inappropriate movements or the wrong movements re-aggravate it, and you got to find that happy medium. And that spectrum looks a little different for everybody, depending on their age, depending on their tissue response, depending on how healthy their tissues are. I mean, there's so many, the severity of the injury, all of those things.
Are you saying it depends?
It depends.
It depends. All right. Well, Doc, this has been great, man. I really appreciate you being on the team and taking your time. You were very thorough today. I learned a lot, actually. So awesome. I really appreciate it. And thanks for sharing it with the listeners.
We'll see you next time. Yeah, this is fun.
You got it, man. All right. Take care. Have a good rest of your day.
Bye.
All right. Bye.